We're going to be talking about smoking cessation, and we're really fortunate to have Mandy here because she is a lifestyle interventionist with the big smoking cessation study that's underway here at Hopkins. And so she's going to talk about the project, talk about smoking cessation broadly, and then, as all the other presenters have done, think about how it applies to Rich Life and how we interact with patients. So here is Mandy Stinchcomb.
Thank you. So hi everyone. So just a little bit about me. So like she was saying, I've had about several years with Hopkins so far, about 3 years. And currently what we're doing is there's 2 different studies that we're in charge of right now. One is called the IDEAL trial, and this is an 18-month-long study that we're doing looking at cardiovascular disease risk reduction in participants who have severe mental illness. And so with this study, what we're doing is concentrating a bit more on a weight management side. Our PI for the study, Dr. Dalmit, she is very big into cardiovascular disease. And then also, we just recently started a study about, I would say 10 months ago, called the TRIUMPH study, which is looking a lot closer at smoking cessation, and we do these studies over a longer period of time, over 18 months, in the SMI population. So for the TRIUMPH study, what we provide is medication as well as the counseling portion of smoking cessation. So and that's what I'll be planning to talk a little bit more about as we continue. So just overall, what the hope is for today is looking at by the time you're done here, is understanding the pros and cons of smoking. Sometimes it seems so simple, but at the same time, most people don't think about it when they're talking to people about their smoking habit. And then also just providing you with some opportunities to experience some different resources, as well as be able to offer some support to the patients that you see who are wanting to quit. So how does this apply to you? So from a care manager perspective, it's more of the monitoring of the protocol, trying to support the patient in any way that you can, and then also trying to provide the different resources for them. From the community health worker perspective, it's more of supporting the care manager, as well as discussing and encouraging the patient to make sure that they're kind of following through on their end as well, and being able to provide the support in any way that you can. So I wanted to take a couple minutes just to, I know we've all kind of experienced people who have quit smoking or have thought about it, and really I just wanted to get an idea of what some of your guys' perspectives or some of the strategies that you guys have used in order to help some of your participants. Does anybody have a good example or anything that you've done? Or is it new?
On this because I'm proud of myself.
Okay,
This.
okay, perfect.
So this is a personal thing.
Okay.
But I smoked. I used to smoke Newport 100.
Okay.
Okay. And I smoked cigarettes. Like for real. And I sort of picked up the habit while I was in nursing school. Like one of my good girlfriends smoked Marlboro Lights. I call it the white girl cigarette, no offense. So she smoked a Marlboro, so I was like, oh, let me try one, girl. I'm stressed too. So I didn't really like it. And it wasn't until after I graduated nursing school, how I really started smoking cigarettes like that is because I'm getting ready to tell, but corner stores, I'm not gonna say where, but you can get loose cigarettes, okay? Right. So that just makes it easy for you to just get a couple here and there and be like, oh, okay, at least I'm not smoking a pack. But then those little couple of loose ones turns into me smoking a pack, and then more recently, prior to when I quit, turned into smoking a pack, depending on my level of stress. If I got a bunch of papers to write, I felt like the cigarettes sort of helped me get through my work. Okay. And I could have smoked 4 cigarettes while I'm typing a paper. And so that's in one sitting. So for me, it was because what helped me stop smoking cigarettes in the past, because I smoked when I was like a teenager too. But then I got really sick because I have like really bad sinus issues, and I felt like because the cigarettes made me sick, I had sinus problems. I'm just gonna stop smoking, and that's when I stopped. But then the same thing sort of happened just recently where I had like some really bad sinus issues. I developed a cough. The universe was speaking to me because a lot of patients at one of my sites at Total Healthcare, for instance, so many folks are walking in on portable oxygen, right? Walking around on portable oxygen, and I'm like, I don't want that to be me. I gotta stop. And then one day I just quit cold turkey. Like I just quit cold turkey. And I know by doing some studying that if you haven't had a cigarette in like 24, 48, maybe 72 hours, then sort of that nicotine is kind of like out of your system and you have less cravings to want to smoke. And since then, I haven't smoked a cigarette in like months now. And I'm okay. Like, I don't crave a cigarette. I don't want a cigarette. I certainly don't need it for my health. So for me, the things that helped me to quit was health reasons, the universe speaking to me as far as like seeing other people on oxygen and kind of comparing that to myself to say what I don't want. So what I don't want is to be taken out of here early by something that I know is well within my control.
Right. No, and that's a great example. So this situation is one that I experience on a regular basis. So there's a lot of people, so a lot of the patients that I work with have that same situation where they are stressed, or they find that it's one of the things that they can control. And because there aren't many opportunities in the serious mental illness population for much scope outside of that. It's a rather low income population, so that's one of the things that they do control on their own. So similarly, and so that leads to a lot of what we'll talk about today, is just different ways for you to be able to have that conversation around smoking and really what you want to bring up or address when you're talking to different people. Because a lot of, similar to I'm sorry, what's your name?
I'm Danielle.
Danielle. So similar to Danielle, there's different reasons, and a lot of them have to do with maybe more extreme situations that come up, health concerns that come up that make people really want to quit. Most times, because smoking is such an internal thing, when it comes to the health problems that occur, it's hard for people to be able to address them or to notice the different changes that they're making or that their smoking is making from quitting. And so a lot of, like I said, a lot of what we'll talk about is more around the conversation that you'll have, because this is one of the things that our studies, Dr. Domit's studies, really specialize in, is the idea behind motivational interviewing and how that can really help people to kind of come out of their shell when it comes to more difficult topics, such as their health, such as their weight, such as blood pressure, all things that you guys deal with on a regular basis. So just to get started, so some of the effects that smoking has on the body. So cigarette smoking is one of the leading causes of preventable death and disease within the United States, and almost 500,000 people die each year from just cigarette smoking alone, in combination with the other diseases that develop. And so when we're looking at cigarette smoking, both, or I guess in combination, HIV, illegal drugs, alcohol use, car accidents, and just firearm accidents, all of those in combination, all those deaths throughout the year don't even come close to adding up to where it is with cigarette smoking death. But at the same time, there's some positives that are going on too. So within just the past several years, between 2005 and 2014, there's been a decrease in the amount of people in the United States who have quit smoking, or an increase in the amount that have quit smoking. And so the percentage went from 20.9, almost 21%, down to 16.8%. So there are some positive things that are going on. I think a lot of people are developing these different programs to try to help in any way possible that they can. And so just between the year 2013 and 14, there was a decrease of 1%. So I know that doesn't seem like a whole lot, but in the respect of how many people are smoking and how many people are getting more access to some of these things that can really help them and really motivate them to quit, that's a pretty big percent for us. And so despite the decline in smoking, smoking is associated with 1 in 5 deaths per year. And so, of those 500,000 deaths, those are only 1 in 5 of all the people that pass away in just 1 year. So on average, a person who smokes has the likelihood of dying 10 years earlier than a person who doesn't smoke and who has never smoked. But at the same time, there's a lot of benefits from just quitting smoking and reducing your risk of an earlier death such as that. So this picture here is just looking at, like I was stating, the 500,000, almost 500,000 people, and just the breakdown of the disease category in relation to cigarette smoking and its use. So overall, what we're finding is that smoking and quitting smoking is one of the best things that a person can do for their health and for their quality of life, based off of just these facts alone. And so this picture here is just giving you a little bit of an idea of what's going on with when it comes to the risk of smoking. So your entire body is put at risk when you smoke cigarettes. And so one of the things that we're finding is the brain, the heart, the lungs, the blood, all are affected throughout the process of just inhaling one puff of a cigarette. And so, some of these areas we might not have thought would have been affected necessarily. I think one of the major ones that has stood out to most people is the idea of blindness when it comes to smoking. I know we hear a lot about that with more around diabetes, but it's similar. The effect is still similar to that with how it affects the blood vessels and things like that. And so just to give you an idea, so each time a person takes an inhale of a cigarette, it takes 7 seconds for the nicotine or the carbon monoxide just to get to the brain. And so 7 seconds later, you're already affected. All these different systems are being affected in just that short amount of time. And so by just quitting or just cutting back or just smoking one less cigarette a day, that a lot of these systems, a lot of these things are going to improve over time. And so what we're looking at is just some different health risks that come from smoking. So in comparison to a person who does not smoke, a person who smokes increases their risk of heart disease, increases their risk of stroke, and of lung cancer over the course of just the time that they're smoking. So a person is about 2 to 4 times more likely to develop heart disease or stroke throughout their lifetime by just smoking, and about 25 times more likely to develop lung cancer. And then smokers, in comparison to non-smokers, they tend to cause damage to their blood vessels, which I'm sure you all have heard about, as well as increasing their risk for diabetes. And a lot of the patients that I see talk a lot about tooth loss and tooth decay, mainly because when we think about some of these different visual things that people can see, that's one that they really identify with. And so as a person continues to smoke, and each time they take in a hit of that cigarette, it has to go through their mouth, right? So all of those chemicals, there's over 4,000 chemicals that are in a cigarette at any given time. And so all of those chemicals are kind of getting stuck in there and really drying out the mouth. That's one thing that that does happen as a person is a chronic smoker like that. And so that drying out, not having the saliva in your mouth, really causes some issues for the teeth and for the mouth. And then lastly, it's just looking at the diminishing overall health that most people experience. So there is an increase in the sick time that it takes for people to recover from sickness and colds, as well as an increase in the healthcare costs. And so as a person is sick and they're trying to recover from a cough or from a cold, they're finding it a bit more challenging because you're feeling sick, but at the same time you want a cigarette. You're going through withdrawal of a cigarette, and it's a little bit more challenging because your body's not only fighting off the sickness, but also fighting off the damage that's being caused from the cigarettes that you're smoking. And so when we're looking, this is a little different from what I have, but so the way that smoking affects hypertension. So overall, what happens when a person takes in a cigarette? So blood pressure is increased. That's the major thing that a lot of people hear about when it comes to blood pressure and with smoking, is that the blood pressure is increased. So each time a person takes in a hit of the cigarette, each one of your blood vessels, as you know, it's contracting and dilating. And so as that happens, it's putting extra strain on your heart. It's making it more challenging for your heart to be pumping that blood through those vessels. And so if you think about it similarly to like a rubber band, you have a rubber band and each time you stretch it out, it does its job, right? But over time, as you continue to do that, think about how it kind of cracks and it breaks apart. That's what happens to the blood vessels as the heart is working against smoking. So as the blood vessels are contracting during each time a person smokes a cigarette, the blood is having a harder time going through those vessels, right? And so as that happens, that each time that happens and over that period of time, it's cracking like that rubber band. It's having a harder time to recover. It's having a harder time to repair. And as it repairs, it's thickening those walls. And when that happens, it makes it harder for it to be able to dilate and contract. And so what we see is that over time with smoking, that a lot of those vessels become thick and make it very hard to get any blood throughout the course of the body. So when people are smoking for long periods of time, what they find is that they tend to stop feeling circulation throughout the course of their fingers and their toes. That's kind of where it goes first. Again, similar to how they affected diabetes. And so with that being said, those vessels are being damaged and it's making it a lot harder on the heart, and therefore we can kind of see how the 10 years between a non-smoker and a smoker, how that might add up over time with the damage that's being done. Oh, and I want to go to this slide just first. So this is a slide or a handout usually that we provide to our participants. This is giving you an idea. So we've talked a lot about the health risks behind smoking, but this is kind of what we look at as more of the positives. So this gives you a bit of a time frame of, so if you quit smoking, what happens just 20 minutes after? What happens 12 hours after? And what happens a week or 2 weeks? And so this kind of gives people a lot of hope when it comes to quitting smoking, because these are more of those physical things that we tend to see. And so just within 20 minutes of quitting smoking, your blood pressure and your heart rate recovered back to a normal spot or a reduced smoking spot. And just within 12 hours, your carbon monoxide level gets back to a non-smoking level. So I'm not sure, and correct me if this is something you've already learned or know, but with cigarettes, the main thing that is the problem or is the health concern is the carbon monoxide. So it's not the nicotine. And so just to be able to have your carbon monoxide level return back to normal after such a short period of time, a lot of people get a lot of motivation from that, because it's easy for us to talk about oxygen and how that works, but adding another chemical in there, sometimes people find it a bit more challenging and really relate to that one. So with our study, what we do is we have a machine called a smokalizer, and so this machine will test their carbon monoxide. And so as they're cutting back and they're quitting smoking, we test and make sure that as they continue to be working on their smoking, that those numbers are going down. And so it kind of gives them yet another physical element of the progress that they're making. Because as they quit and they're going through these 2 weeks, these are things that they'll be able to notice. They'll be able to see some of those changes and be able to get satisfaction out of the work that they're putting in. And so one of the things that I always encourage when we talk about the benefits of quitting is always trying to find those external things, those physical reasons of why they're wanting to quit. So we can sit here and we can talk about some of the health risks, but sometimes that doesn't directly translate into some of the motivations that people have for quitting. Similar to what Danielle was saying, that she had a scare, kind of situation that came up that could have prevented her from, quitting smoking, but at the same time, it actually motivated her in that direction. So a lot of things that we try to discuss when it comes to just those physical things, those physical changes, is being able to identify maybe some differences with their teeth or with how they smell. Or even a lot of people, when they are smoking so frequently, have a change in their fingertips. They turn yellow from just how much the carbon monoxide is going through that area while they're inhaling a cigarette. And so we try to really emphasize those physical things to kind of build off of in the first place. And then some of these things where you can really see these over time, then they become more of a motivation for them as well. And so I know we're all pretty familiar, am I right, with the stages of change. So the main reason that I bring this up is mainly, like I was saying earlier, sometimes it's more difficult to talk about people's health. They don't always want to do it. And we can have this information, but how do you deliver it to somebody to the point that they recognize that it's important, not just to you, but also in their life as well. And so so with smoking, what we find is that people tend to be all sorts of places with their smoking. Some people really want to quit, some people really don't. But what we find is the stages of change is very, very helpful for this situation, because most people in their lifetime have tried quitting. Whether it was when they were young, whether it was 2 weeks ago, whether it was just for an hour. I really encourage you when you're talking to your different patients that even just building off of those small times. So you're in here with me for an hour. That's an hour that you're not smoking. That's an hour that they're not smoking. That talk time that they have with you. Some people find that to be just as challenging as if they were out having it accessible. And so being able to build off of those things really becomes encouraging for them as well. And so throughout the course of your conversations with these patients, some days they might be in one stage, they might be in the action plan and they're ready to go, and they're about to quit smoking for the day, and they come in the next day and they weren't successful. What do you do in that situation, right? So now they're back, they're contemplating whether or not they want to do it again, right? And so what we found, and what really brings the stages of change into the smoking cessation realm, is that we always talk about the importance. So we've talked about all of the risk factors for why people should quit smoking, right? And those are the important things that a lot of people have in their thoughts, have in their mind. But at the same time, with smoking, because a lot of people have tried in the past, the confidence might not be there. And so, as we all know, if importance is high and confidence is low, there's very low chance that a person's going to make any type of change. And so being able to increase that confidence is really what makes a lot of my job what it is that's where you kind of come into play with the counseling portion, with the conversations that you have, and being able to move them from these different steps and different stages over the course of your conversations. And so, are there any questions so far? I know that was a lot of information. Yes?
Do you consider people who chew tobacco to be smokers?
So yes, so similar, so not in the same way, right?
Yeah.
So the only reason, and that's a really good question. So with our study, it's not necessarily something that we look at closely, because what we're checking is the carbon monoxide. But at the same time, it has very similar effects.
Mm-hmm.
So very similar with the effect on your blood pressure, with the nicotine going into your system, and the different health risks with the mouth and your oral cavity. So we don't necessarily recommend it, but at the same time, that's not something that I look at per se. But like I said, they all have very similar risks as well. So I wanted to spend some time talking about how to start the conversation with a person who is smoking, right? So this should be helpful whether they are trying to quit or they are just a smoker. Just any conversation that you're able to have with them. So so if you've ever had a conversation with them in the past, what's some information that you tried to gather from people who smoke? Okay, perfect. Okay.
How long have they been smoking?
Okay.
Trade equipment class.
Right, yes, exactly. Good. So yes, and then we'll also discuss just how to talk as well. So just to start, so this is just some things that that I put down that I thought might be helpful for you just to think about. So, right, so how much are they smoking currently, right? How many packs are they smoking? How many cigarettes do they smoke in the morning? How many cigarettes do they smoke in the afternoon? When they're smoking, what's going on? So how accessible are they? Are there other people around? What's their source of cigarettes? Do they get them from other people? Do they go out and buy them? Where's the closest store that they buy them at? So so you're able to kind of stretch outside of these scopes, right? So any information that you can get from that person is gonna help you, right? Yes?
You know, I don't know if it was up there, another good thing to ask somebody, what is it that you doing at the time that you were smoking? There was a commercial on TV one time about a gentleman, he was trying to stop smoking, but he realized every time he would go get in his car, he will always light a cigarette. So when he got in his car and he looked around, he realized that was one of the triggers for him to smoke a cigarette.
Right, and that's great, and that's a key. So triggers is a key word that we use with smoking cessation. So a trigger is any person, place, thing, emotion, anything that's going on at the time that they pick up a cigarette. So being able to identify different triggers, and so being able to identify different times throughout the day when they smoke, that's where the trigger situation comes into play. So most people, what we find is that in the morning is a really high pressure situation, a high risk situation for them to smoke, or after a meal. A lot of people tend to reward themselves after a meal because they've finalized the meal and it's kind of like dessert. And then in the evening is a big time. So because they're finalizing their day, or because they're kind of preparing themselves to go to sleep and not have cigarettes for the whole evening, that makes the morning one just as challenging because they are not having that nicotine overnight. And so similar to, I'm sorry, your name? Dorothea. So what Dorothea was saying, that those are different times throughout the course of your conversation that you're going to say, that you could say to them. Okay, so maybe those ones are ones that you need to have. Those are ones that you can't give up right now. What are the other ones that you're smoking? What's going on when you're smoking those ones? Who's around? How are you feeling? Because that's how you kind of talk them through which cigarettes they're going to give up. So that's kind of starting that process of the smoking cessation. So really being able to identify which ones they have a harder time giving up, and being able to identify the ones that maybe are just more of a habit for them. But then also we want to talk about the likes and the dislikes of smoking. So, you know, we all know what the harm is behind smoking, but a lot of what keeps a person smoking is what they like about it. So as long as they're able, and I know it seems a bit odd to say, you know, Jim, what do you like about your smoking? What are the benefits that you're getting from continuing to smoke? Seems a little odd to ask that, but those things are the things that are going to help you to be able to identify whether or not it's going to be something that he can do now or maybe in a couple weeks. So kind of coming back to that stages of change model. And then also with the dislikes. So you want to ask what they dislike about it, because that's going to in turn be the motivations for potentially why they quit. And being able to, something to have for you to be able to identify as well. And then their past quit attempts. So when was that? How long ago was it? How long did they quit for? And even like I was saying earlier, even if it's just for a couple of hours, sometimes that can be just as challenging for a person than to just completely quit out of cold turkey. And then also we talk about their experience with smoking assistance. So have they used anything? Have they quit cold turkey? Are they using a patch, a lozenge, gum, a smoking assistant medication? All of those options that could be available to them. And I think what you'll find is most people tend to go to more of like a patch and a lozenge because they're more accessible. The medications are more current and a more current study that is out there, so they're not totally familiar. And then talking about overcoming just different barriers to quit. So a lot of people have different reasons of why they continue. So it might be some of those likes, but at the same time, it might be every person that they know in their house smokes. Or every time they go into the living room, that's a place that they can smoke in. And so being able to identify maybe some of those reasons that it's a bit more challenging for them to quit and stay quit. Because starting with those things and being able to kind of troubleshoot around different strategies and different activities or different places, that can really help as well when it comes to this process. And then one of the most important things that we talk about is just the support system. Being able to identify either people who don't smoke that they know, or even being able to just identify very positive people in their life, whether or not they smoke or not. Because people who smoke can also be helpful and can be support systems for a person to smoke. It's a little more rare, but at the same time, it's still possible. And so being able to identify that and other people outside of yourselves, because you're going to be having these conversations with them, being able to identify somebody else, somebody maybe that's at home, or somebody that they can call when you're not available, could be very helpful for them as well. Can we think of anything that I might have missed, or that, or any questions about these items up here? Perfect. And so I just wanted to take some time to talk about just how to ask for this information. So I know you've gotten a bit of exposure to motivational interviewing and just how that works. So one of the techniques for motivational interviewing that makes it so effective is the idea behind open-ended questions. So being able to ask how or what they do in certain situations. So how do you avoid smoking throughout the course of the day? How would you fill your time if you weren't smoking? What do you do to fill that time to avoid smoking? And what would it look like for you to be a non-smoker? How would it feel to be smoke-free? Or what do you like about your smoking? Just being able to identify some of those things and have it more open. And so the reason that we do this is, especially in the SMI population, because there is not a lot of decisions that are made on their own, this gives them the autonomy to be able to talk and be able to hear somebody or have somebody listen while they are talking. And this opens up a world of difference for most people, not just the SMI population. And then also we use the tell me about. So tell me about a situation when you were able to avoid smoking for 24 hours. Or tell me about some different activities that you like to do that could help you when it comes to smoking. And so being able to open that up and let them feel as if there isn't necessarily a right and a wrong answer to the questions that you're asking. So just some of those examples would be just a close-ended question of, do you want to quit smoking? Well, no, I don't want to quit smoking. That's not something, like, no. So you don't get enough information from that. So more, instead saying, tell me about a time when you tried quitting smoking. That opens up a new conversation. It opens up a time for them to be able to say, oh, well, I've never tried quitting before. And so you know the answer. Do you want to quit? Maybe, but they've never tried before, so they're not sure. Or have you considered quitting? So what, if anything, do you dislike about your smoking? Because that can answer, have you considered? Well, no, I haven't considered. Or, yeah, I've considered quitting, but it's not something I can do. Or, but to what do you dislike about it? They're more open to say, well, I don't, so-and-so got sick and they smoked for 20 years and I don't want to be like that. And then also, what have you heard about why smoking's bad for you? Well, I haven't heard anything. Or my doctor tells me all the time that I need to quit. So every person that we've talked that you're going to encounter has probably talked to their doctor at some point about quitting smoking. A lot of primary care doctors are getting on board with that movement of trying to really implement smoking cessation. And so a way to still continue to ask about that and ask about their doctor's experience is just saying, hey, Sarah, you were at the gym, or you were at the doctor the other day, and I just want to hear a little bit about what your conversation was with them. Can you tell me a little bit about what was talked about? and maybe they'll tell you about smoking. But this way, like I said, it opens it up. It makes it feel a little bit less judgmental, and it gives them the opportunity to not feel like they have to be defensive. And so the most effective thing that that comes into play when it comes to just smoking cessation programs and how they're implemented, it requires two different elements, so two different portions. So there's the behavioral counseling portion, which we've discussed so far, and just being able to figure out what's going on with their smoking, why they're smoking, why they don't want to be smoking anymore, and then there's the pharmacotherapy portion. And so the pharmacotherapy portion is the part that adds the medication or the assistance with quitting. And so what we found is that over the course of the studies that we are putting on is that we provide both of those. So like I was saying earlier, we have a study that is called Triumph. And so right now what we do is we have a study psychiatrist on board our team. And so she is the one who prescribes and follows up with all of the participants that we have with their medication. And so in combination with that, then myself, I counsel our participants and talk to them about smoking cessation, both in a group setting as well as in an individual setting. And just the difference between how open they are and being able to have that contact with you and know that you're that support system and that resource for them kind of opens up a new spot for them. So one of the resources that you might know of, 1-800-QUIT-NOW. Are we all familiar? And so that is this structure is exactly how 1-800-QUIT-NOW is built. So they provide the smoking assistance by sending out the mostly it's NRT, nicotine replacement therapy, to the patients that call in. They send that out, and then what they do is they do follow-up calls with the patients and make sure that they're using the NRT correctly, make sure that they are following through with some of the goals that they're setting up, and really setting up a structure for that program and making sure that they're following it along. It's a little less contact, but at the same time, it's shown to be very effective. Yes?
Is this something that the care managers and CHWs would have like access to, or they already do, or?
Yeah. Do you mean the 1-800-QUIT-NOW?
Yeah.
Yeah. So 1-800-QUIT-NOW is a free service through Maryland, and so like I said, what they do is they supply these different resources or these different material to the patient. I'm not sure, I guess from your perspective, if you're able to kind of, I would assume you would be able to help out with that and helping them receive that, but they provide all of that stuff free of service. Mm-hmm. And so just to give you an idea of some of the different pharmacotherapy that is available to the patients that you will be seeing. So the main one that most people know about is nicotine replacement therapy. So the patches, the lozenges, the gum, and all of those are available over the counter at a pharmacy or in some grocery stores as well. And so also the free quit line that I was talking about is another option for that for most people. And I think, and just being in Maryland and knowing that this is available, I've actually heard a lot more people use this resource than I ever would have realized. So it is a very good resource, and a lot of people use it and have quit doing that method. And then the other two are both prescription medications. So bupropion, also known as Wellbutrin, it is a dual purpose medication. It's treated mostly for antidepressant. This is also a prescription pill that it can be prescribed by their primary care doctor. And it's been shown to be 3 times more effective when it comes to quitting as opposed to just quitting cold turkey. So the way that both of these medications work, and I guess just to touch base on the NRT, is that the NRT still has nicotine in it. So it's supplying the body with nicotine all throughout the course of the day, 24 hours. And same thing with the gum, the lozenges. They all supply nicotine throughout the course of the day and fill the nicotine receptors in your brain to make it so that your body doesn't need that nicotine from the cigarette. Now it has it from the patch or the lozenges. Whereas the medications, the Chantix and the Wellbutrin, both of those options do not contain nicotine. So what they do is the medication takes over that nicotine receptor area in the brain and kind of tricks your brain into thinking that it has nicotine. And so with that, throughout that process, your body is covered for the duration of the time. So most people take these medications in the morning and in the evening, and they're covered for the duration of the day. And so what happens, what we've seen with both medications is that it takes the desire for a cigarette away. It covers them for the whole day and makes it so that they don't want a cigarette. And the main thing that we've seen with the Chantix is that it actually makes the cigarettes taste bad. So most people tend to have a bit of a craving for tobacco, that tobacco taste, but it actually makes it so that you really don't want to taste it, and they tend to start tasting bad as a person is on it longer and longer. And so one of the main structures that we talk about when we're looking at smoking cessation is developing a quit plan. So this is going to be pretty useful for you when it comes to just the structure behind the smoking cessation. And so what we talk about is setting a quit date. So what we try to do is get our participants right now, they get on a medication. Our study, the main prescribed is Chantix. So they get on Chantix and they're on the medication for a certain period of time before they set a quit date. And usually they're on it for about 30 days, and their quit date is 30 days later. So they start it, and then 30 days later is a quit date for them. So the idea behind a quit date is for them to quit completely, right? So so usually what we do is we have a calendar, and we say, okay, so you've started using the patch, or you've started using the Chantix. Now let's look forward and let's see where might be a time where you could quit. What date within the next 30 days or within the next 48 days looks like a good day that might be a day that you could try quitting smoking. And so we set a hard quit date for them. And so over the course of those next 4 weeks, that's where you guys come into play, right? So you're going to be preparing them for that date. You're going to be, like, before that quit date happens, you're going to be really encouraging them to remove their cigarettes from their house, or remove or stop bringing them with them, or leaving them at home when they go to the grocery store. You're going to talk to them about possibly getting rid of their ashtrays and totally removing them from their house, mainly because that's a trigger for them. If they're used to going outside every day, or if they're used to staying inside and smoking, forcing them to go outside, forcing them to change the habit a little bit, because that way they're getting used to something new, right? And so we always encourage having them tell family and friends about their quit date, mainly because this is where we really see the commitment come into play. So most people, and I don't know your experience, but most people tend to not want to do that because they're afraid of failing. So being, it kind of shows maybe more of a confidence when they are able to tell people and really kind of spread the news around. So we really encourage that, but not everybody does it. And then we try to talk to them about washing their clothes, or washing their bedding, or Lysoling their house, or Cloroxing their countertops, really trying to get rid of that cigarette smell. Because even though they might not smoke inside their house, all of everything that they have on carries that smell over the course of their whole entire day. And so really trying to clean those things and make sure that that smell is removed. That way it kind of promotes a healthier lifestyle, right? Because they're not smelling it. And most of my participants say that once they quit, or once they're going through the quitting process, they cannot stand the smell of cigarettes. Cannot. So being able to wash their clothes is a big thing for them. But the one main thing that we always encourage is planning out the quit date. And so what this means is, so let's say June 1st is going to be is Danielle's quit date, okay? So what we have each person do is we give them a sheet, and we say, okay, so starting at 6 o'clock in the morning, what are you going to do throughout each point throughout the course of your day? Every 15 minutes or every 30 minutes, having them write down exactly what they're going to do that day in order to keep them busy. Because if you think about your own experiences, like if you're busy at work, you don't think about eating, right, per se. Or if you're out, if you're out all day doing something and you're busy, maybe it's not the first thought. Where we really need to eliminate that from their thought is really trying to figure out what they can do to make sure that they're not smoking for that day. And mainly the reason that we plan it out is because they need to see some type of success, right? Whether it's an hour, whether it's 2 hours, whether it's half of a day, being able to see that success on that quit date, that's going to help them in the long run. Mainly because a lot of your conversation, if it doesn't work out, you're going to talk to them and you're going to be able to say, hey, what did you feel like worked and what didn't? And so planning out that day and sticking to that pattern and those activities that they have down is going to be really key when it comes to that quit date. And then so on the quit date, obviously we want them to stick to the plan, right? Because that's what you worked so hard to get them to plan out. And so planning that day out, that's where that comes into play, okay? And then just being able to use their different resources that they have. So whether that resource is you, whether it's they have patches, making sure that they write down, I'm going to put my patch on at 6 o'clock in the morning. As detailed as you can possibly get it is going to be the most helpful for them. And then always finding a support system for them, in case you're not available or they have somebody significant in their life that can really help out with this date. And so we always talk about having a scheduled time that you would check in with them. So this is probably the most important thing that you yourself can do for them, is being able to schedule a time with them on that quit date. Mainly because when you check in with them, you want to know whether or not they slipped and had a cigarette, right? So what we have the plan for, and then the scheduled date for you, or the time for you, is to check in and make sure, hey, how are things going? What have you found to be the most challenging part of today when it comes to not smoking? Or what have you been doing that's been so positive, right? And so you really want to emphasize those things because that's what's going to keep them going, right? So don't get me wrong. I mean, I talk about smoking cessation to my participants every single day, and we still have people who will not report in that they have slipped. And it just happens. And sometimes you have to just build that into the conversation because they might not be confident enough to tell you. So being able to say, well, I mean, some people have had a real problem when it comes to just being out and being in the community at the bus stop. How was that for you today? Did you feel like you wanted to have a cigarette at that time? And really trying to dig a little bit without being so evasive, right? And really trying to identify if there are any slips, because a slip, having one cigarette, doesn't have to mean that they need to start all over. That just means you guys need to set a new plan. They have to come up with a new plan, right? To continue the plan that they've already set in place. And so really trying to get them back on track, because each person who tries quitting, on average, takes them about 5 or 6 times to fully quit. And so that slip doesn't have to be the end all, tail all. So, and then also just being able to find their own motivations and being able to remind them of what their motivations are when you're the one talking to them at that appointed time, if they do happen to have this situation come up, but also just because they've been successful. So you kind of want to cheer them on a little bit for that success that they're having. And then this is more for your own support. So, like I said, I really do emphasize having supports outside of you all. But then what we do in the study right now is we do follow-up sessions with everybody. So that phone call, but then also the next day, it tends to be a high-risk situation for most people, because after the quit date, then the next day is just another day, right? Yeah, go ahead.
How long, on average, if you can give a number, but how long does it take for somebody to actually quit? If you've had a bunch of period would look like? 6 months?
That it
year
takes
and a
them
half?
to quit.
Yeah,
So,
a couple of years, do they quit?
no, that's a great question. So right now, like I was saying earlier, for our study, we started about 10 months ago, and I have some people who will quit immediately, so we get them on a medication, and right after that, depending on their motivation, they do it immediately. And then I have some ladies that it's taken them 10 months, and we still don't know where they're at with it. They've really decreased their smoking, but it's just those last couple of cigarettes that they just can't give up. And that's probably one of the hardest parts coming from this standpoint and from your own perspective is you know what they need to do. And it's more, people are not going to be successful with quitting smoking if they do not have the motivation behind doing it. And that's probably one of the hardest parts coming from the counseling perspective is that if you can't give them the motivation, you can tell them, you can try to kind of lead them into what they need to be doing, but you can't just saying, hey, you need to quit tomorrow. Not going to be helpful. So on average, we have 8 people in the study in just my branch of 12, and 8 of them have quit in the past 10 months. So it's kind of just those last few that we're hoping for. So it seems like if the motivation is there, and that's also your job, is to kind of increase that too, and get them on board with feeling comfortable and feeling confident. And so great question. So one of the ways that you build their confidence is by having them try different things, right? So the quit date is just one of those things that they try. We have a thing called a practice quit date. So they go into the day not smoking, not wanting to smoke, not thinking they're going to smoke. And then, let's say 4 hours later, they give in and they have a cigarette. They at least are able to see that success throughout the course of that time and be able to build off of that, because and that's why the past quits help, is because you want to be able to identify what they were doing at the time that was helping them to not be smoking. That's going to be a big portion for you as well. And so these are just some of the resources that we have when it comes to the smoking cessation and the options for you as well. So like I was talking about earlier, the 1-800-QUIT-NOW, that's a big thing that is a free service for anyone. I think the only thing that needs to happen is you need to put in a zip code and then be able to say what county you live in Maryland. And then they provide all of those other options for you. And then the big thing is, because it's becoming more of a concern for doctors right now, their primary care physician is always a go-to person in order to get another, to have another resource for them. And then I know there's some like phone apps as well that people use when it comes to like their countdown and things like that. And then I did have a little bit of an activity, but I know I'm going to be going a little bit long. So it was just trying to address just open-ended questions. But at the same time, do you guys have experience with that? Is that something that you're used to doing? Yeah?
My question is,
Okay.
are you ready to quit now?
That's what you say?
Yeah,
Okay.
to some folks, and
Mhm.
they might say, yes, I'm ready to get more information, then I'll just pass that along to the provider, say, hey, patient so-and-so
Okay.
says that they're ready to quit.
Okay.
So that's sort of a segue into us sort of offering or like finding out what the motivators are, and then possibly supporting them with quitting, whether if it's sort of like the smoking cessation classes that we have at Total, and also with medication like the nicotine patches or the prescription pill.
Mhm. And yeah, and that's a great example. I would invite you just to ask about if they've ever quit before, because sometimes that's an easier lead-in to the conversation, as opposed to just flat out saying, is this something that you're wanting to do? Mainly because if they have quit in the past, that's a pretty good indicator for most people that they would either be willing or wanting to do so. And then this is just a couple of different resources for you. Very good material on here, just in regard to smoking cessation and different ways that they build material for developing a program. So I encourage you to look at those too if that's something that you're interested in. And then just overall, just to summarize, I know there's a lot of information that's been handed out today. A lot of the health risk information was more for your own use, mainly because that way you have some information to go off of and a little bit more knowledge. But then at the same time, always providing the open-ended conversation, as well as really the pros and cons of why they want to smoke. Even if you have a couple of minutes, that's probably one of the best strategies that you could use. Are there any questions? Well, thank you guys for your time. I really appreciate it.